Hey everyone, welcome to our November AC Forum webinar. We're glad you're here. We're going to start off with some announcements today because we've got a packed webinar and we want to make sure we have enough time for everything. So we'll start with, first of all, our new AC University. We've got new content coming soon with hubs and spokes. AC Forum's newest premium content, Hubs and Spokes, is launching soon. Hubs are our core courses that provide foundational knowledge on topic areas and disease states. And then our spokes are dynamic advanced material delivering the latest developments in the field. There will be 5 hubs available and bundle options as well. So keep a lookout in your email for more information. AC University. And remember to visit AC University for all your educational needs, from free resources to premium content that help you dive deeper into antithrombotic care. Everything you need is right at your fingertips. Next up is THESNA. So please join us at the THESNA Summit. This is going to be March 19th through 21st in Portland, Oregon. Don't miss the early bird registration rates that end tomorrow, November 14th. And if you're submitting an abstract, the deadline is December 5th. Remember to say you are affiliated with AC Forum when you register. Okay, so I would like to welcome our presenters today. We have an exciting program for you, highlighting all the amazing resources available to you on the AC Forum website. We are putting a link in the chat for a PDF that lists all the resources for you that we are covering today. I would like to welcome Candace Bryant. So Candace is anticoagulation clinical pharmacist practitioner at the VA and Sierra Nevada healthcare system. She'll be talking with us about resources available for training and lifelong learning. We also have Bishoy Ragheb, who is anticoagulation clinical pharmacist practitioner at the VA and Eastern Colorado healthcare system. He'll be sharing with us patient care resources. And then we have Tara Lech, who is director of anticoagulation services and stewardship at Beth Israel Lahey Health System. And she'll be sharing with us our stewardship and center of excellence resources. So thank you all for being here. I'm going to go ahead and welcome Candace.
Okay. Hi, Naomi. Can you see my screen okay?
Yes. Thank you, Candace, for being here. So this is perfect timing because I have a PGY1 resident, Taylor, who just started her anticoagulation rotation with me on Monday. We received a consult this morning requesting a patient be started on rivaroxaban for subclinical AFib. I assigned it to Taylor, of course, but she has never heard of subclinical AFib. So where could I direct her within AC Forum's website to gather more information?
Yeah, so within our website, the place that I like to go for residents particularly is our resource center. So first, to really get to AC Forum's website, you can just use your favorite web browser, type in Google AC Forum. It'll be the first link that populates, and that's how to get to our webpage. So this is what the webpage looks like. And then to get to our resource center in particular, there's a couple different ways to do that. I think the easiest way is up here on this tile that shows resource center. If you hover over it, it drops down this screen here. And so this is a good overview of everything that we have in our resource center. And the resource center, just a very brief description, it's a comprehensive database of guidelines, tools, best practices to really support a variety of healthcare professionals to deliver top tier antithrombotic patient care. And so it's one of my favorite places to have for residents to visit. And so just briefly to give an overview, on the left-hand side here, we have a few different resources, which are some of, I think, the best ones that AC Forum offers. We have our rapid resources, which are 1 to 2 page clinical guides that distill down relevant literature and guidelines into sometimes complex patient care topics. So it could be something like a cancer-associated VTE or antiphospholipid syndrome. Or rapid recaps are really nice and a good way to stay up to date. So they are bite-sized summaries of the top publications that have come out from the prior month. And those are just a 1-page PDF document distilled down really nicely for a quick read. Clinical FAQs are just like they sound. So just frequently asked questions, generally dealing with clinical topics. And then our literature library is a really cool resource. It is pulls in publications from PubMed that are relevant to antithrombotic care and sorts them and organizes them for you. And that's pulled every 2 weeks. So that's a great place to look to see what's come out new in the literature, has really good sorting features to find exactly what you need there as well. And then we can see here, there's kind of 3 different buckets of things also in the Resource Center. So we have a disease state category, quality improvement category, and then a situational management category as well. And so under each of these, we have links to various topics. And within each of these topics, there are really good resources, can be like for disease states, like clinical guidelines, relevant literature, best practices from other sites and facilities that others can use, and so on and so forth for all of these other topics as well. So this is a great place for residents to visit. It can be very overwhelming though. So if you're just looking at this, you're kind of like, well, where would I even start with subclinical AFib? And that can be challenging for residents to try to navigate, especially in a 4 to 6 week rotation if they're not super familiar with our website. So the place that I actually like to direct them to go is our search function, which is located in the top right here. So if we go to search and let's just type in subclinical and see what we get. And so we can see here we have 5 results dealing with subclinical AFib. In this purple box here on the right, it tells you exactly what they are, where they're located. So we can see this looks like a clinical trial located in a resource center. Here's a webinar, and say we're looking for something like a webinar. The resident was interested in watching something to learn more about subclinical AFib. So let's actually go to this webinar and see where that takes us. So you can see here, it gives us when this was done. So the live date of the webinar, which was earlier this year. So super relevant to our clinical practice today. Gives a brief description, a link to the recording, and then the faculty present on that webinar also. Each of our webinars is about an hour, so that's a pretty good length amount of time that we can have a pretty detailed discussion or pretty detailed video about a clinical topic for a resident. So this would be a great place for them to start. And then within each of our webinars, we also have a link to our webinar archive up here at the top as well. And so if we go to our webinar archive, this is a web page with all of our archive webinars from AC Forum. We can filter them by topic, by years, or we can search as well. And so since we're dealing with subclinical AFib, let's just go to AFib as one of our topics and see if there's any additional webinars there that may be useful for our resident. And so sorting there, we see 4 different webinars listed here. One of the newest ones being a discussion of the 2023 AFib guidelines. So that may be another one for our resident to watch as well, since we know guidelines are gold standard to go to when we're looking at clinical topics. So between the previous webinar, this webinar, we've got a couple hours worth that the resident could watch of really good webinars to create that good foundation of just learning about subclinical AFib. Let's go back to our search function and see if there's anything else that maybe we would want to have that resident look into. So if you just do the back button, it'll take you to where your search tab was before, so you don't have to redo that. So then we previously saw this here, looks like a clinical trial located in the Resource Center, and we can see a brief description, and it looks like this is actually the Artesia trial. So we know that that's a recent publication that's come out about subclinical AFib. So let's visit that link and see where that takes us. And so this actually takes us to our AFib resource page. So like I showed earlier, under the Resource Center, we have kind of these 3 different buckets here of disease state, quality improvement, situational management. So this is actually the AFib link is where this is located at. In each of these little tabs, you'll see on the left-hand side, there's different categories of things that you can find. And those do vary depending on what you're looking at. But generally, we'll have some examples of excellence, so best practices, guidance, which is your guidelines, and then relevant literature, which is the literature that we feel is most pertinent to be within those tabs and links. And then sometimes you have things like risk calculators and assessments, depending on what you're looking at. So here we can see the Artesia trial is located under relevant literature. If we click this link, it'll open it in PubMed. I'm not going to do that just for the sake of time. But say you plan to look at this with your resident, you guys are getting ready to look into it, and you have a patient show up at your door, so you just don't have time to get to it right now. So one really cool feature that AC Forum does, it's called the bookmark feature. It's located down here, and it's in the middle here, bookmark. There's a couple other open link that just opens it, copies the link. So let's bookmark this because we want to come back and look at it later. We just don't have time to do that right now. So we go to bookmark. It tells us we have to log into our account to bookmark a resource. So that's what we'll need to do. And if we don't have an account, we can actually create one, and I'll show you how to do that as well. There is some content on AC Forum's website, and then also features like this bookmark feature that you can't access if you don't have an account. So I would highly recommend getting your residents signed up for an account. Or if you're a viewer and you don't have an account, please sign up for one. It's totally free. It would take 30 to 60 seconds to sign up for one. And so to sign up for an account, we'll just click OK to exit out of that. There's a couple different places up here. We can do account login or join AC Forum. So either of those will take you to the web page where you can log in for an account or sign up for an account. So I do have an account. So let me sign in and then I will show you this cool bookmark feature. So when you first sign into your account, this is kind of your account dashboard that has a lot of different things here. We could spend a lot of time just looking at this, but we won't for the sake of time. So let's just go back and show that bookmark feature real quickly. So again, we can go to search and subclinical. We'll go to the Artesia trial and then let's bookmark that. So now that we've bookmarked, it says it's been added to our account. You may access bookmarks in your account profile, and there's a link to that here. So if we click that, that takes us back to our account dashboard that we originally saw when we logged into our account. And over here on the left-hand side, again, there's a lot of different things here we could go through, but here's my bookmarks. And then we'll see the Artesia trial is located here. So that's just a really cool feature that AC Forum offers. If you don't have time to look at something, but you really want to later, you don't have to remember or write that down on paper somewhere that you're going to later lose. You can just bookmark it in the website. So those are some good starting points for residents.
Thank you. Thanks for all that information, Candace. I had no idea we had so many different resources on our AC Forum site. And now, so Taylor is really enjoying the rotation. She's asking me if there are any specialty PGY2s in this area. Do you know of any?
Yes, so there is a specialty PGY2 in this area that is newer to the field. So hopefully if you're on this webinar, you've heard of it before, but if not, this is something great to learn about for those that we have interest in pursuing a PGY2. So back on our webpage, if we go to the education tab here, then we could see a link particularly for specifically for the PGY2 residency. So if we click this link, that has a lot of great information that we can share with PGY1s about applying for a PGY2 residency. It has some good links for match day information since we have mid-year coming up soon. And then there's some links that will populate here when this finishes. There we go, when this finishes loading. And just a lot of different resources down here at the bottom, current sites as well. So obviously you can find some of this information on ASHP, but this is a really good web page for residents that we may have interest in pursuing a PGY2 in this area. If we are a residency program director or a facility or site that's interested in getting a PGY2 in thrombosis and hemostasis management, we have a link also for you as well. It's called the Train Pharmacy Grant. And so this is grant funding for a PGY2 in this area. And so there is a lot of good information here as well. If you're interested in having a PGY2 at your program or at your facility, then this would be great for resource for you to also visit if you're on that end as well.
Awesome. Thank you, Candace. So it's now a year later, and I have a vacant spot for a pharmacist. My former resident Taylor has actually applied for it, and I'm planning to hire her. What resources could I use to train her?
Yeah, so for new hires, or if you're looking for any educational resources, we kind of mentioned it in the announcements, but AC University is a really one-stop shop for all things educational. And so that's located under education. You may have seen this just when we were talking about the residency program, but there's a nice link here to AC University, which has so many cool things. We could spend this whole entire webinar just talking about AC University. So just definitely take some time as a viewer just playing around on AC University to see what's all here because there's a lot of really good things. For new hires in particular, I really like boot camp for them. Boot camp is we can click here and just go into the tile and see, but generally a 2-day virtual boot camp lays some really good foundation for just basics of anticoagulation care, as well as staying up to date in relevant topics that may be changing too. It's definitely not just for new hires. Definitely I like to attend as just a refresher from time to time. So if you have a new hire, certainly if it's somebody new to the field of anticoagulation, or if you just need a refresher, it's a great kind of 2-day session to attend. We just missed it, so that's not something we could send Taylor to right now, unfortunately, since we just missed the one that went on last month. But if we go back to AC University, there's a couple other things that stemmed out of boot camp that are actually really good for new hires as well. And so boot camp fundamentals is one of those things. This is something I could probably use myself from time to time. But Bootcamp Fundamentals is 2 videos, modules essentially that are 45 minutes long that cover the very basics of things related to anticoagulation. So first is over hemostasis and thrombosis fundamentals. I could probably listen to that once a month and learn something new, as well as pharmacology over anticoagulant drugs as well. These are completely free. You do have to have an account and log in to access them. So again, just sign up for that free account. It's super easy to do, and you get access to so much really cool content through AC Forum. So that's probably where I would start with a new hire. And then additionally, for boot camp that you can't attend or you missed it, we also have what we call as on-demand boot camp. So that's located down here. And so for on-demand boot camp, it's just like it sounds. So it's boot camp that you didn't attend live that's now on demand that you have access to and just can do it on your own time. So we can see that on demand currently, this was for our fall 2024 boot camp. The registration is closed for this on-demand boot camp. But as I just mentioned, we had a live boot camp last month that will be offered as on demand later. So just stay tuned for that if you're looking out for an on-demand boot camp. So yeah, boot camp's kind of my first stop shop when it comes to new hires.
Thank you, Candace. So Taylor's now settling into her new position well, but she's concerned about being able to stay up to date with literature now that she is no longer a resident. So, Candace, how do you stay up to date on all things anticoag?
Yeah, so I think that's a challenge for a lot of people in different areas, fields of practice. But AC Forum has a really cool thing called the rapid recaps, which we briefly mentioned earlier. So we can navigate again to those several different ways. There is a nice little just link here on our homepage for the rapid recaps, which again is just a summary of the monthly top articles. So these are really cool because they're just bite-sized summaries of what's the top of the top literature that's come out over the past month. So you're not reading, several articles. You now just get to read a nice, concise summary of those. Here on our rapid recap page, you can see they're sorted by year. So we've been doing these since 2021. We also have what we call annual reviews, which is kind of the top of the top over the past 6 to 12 months. Sometimes from time to time, we do a special edition. So here's like a recent one that we did over anticoagulation stewardship to coincide with World Thrombosis Day. And then generally it's one per month is what we have. So if we just quickly look at our most recent one from October 2025, we can see what this looks like. Again, it's just a single page PDF, generally takes about 5 to 6 publications and summarizes those. And then one really cool thing about these two is we have a rapid takeaway, which is kind of like what you're taking away from this article in this summary. So that's a really nice feature on them as well. Something that you can easily read over your morning coffee in the morning once per month. So that's my first place when I'm looking at staying up to date. Secondly, the conferences are a great place to attend, to stay up to date, and just to connect with others in the field as well. And so for our conferences, those are located under events and webinars. We have a link here to our national conference. So let's visit that link to just find out more. For our national conferences, those do occur every 2 years. We just had our most recent one earlier this year in 2025. So our next one will be in 2027. We can see we have a nice save the date here, and that's going to be in Disney Springs in Orlando. So a really cool location as well. For our most recent conference in April of this year, if you weren't able to attend the conference, we now offer what we call conference bundles. So those are awesome because it's, again, the conference at your fingertips, kind of like on-demand boot camp was, or boot camp at your fingertips. You now have the conference that you can watch anytime as well on your own time. And so link to that is here for our available bundles that we do have. Just gives you some information about those and then shows you the different bundles listed here as well. And so you know exactly what you're getting, you know what the topics are. And then these are for pay. And so these are $49 per bundle or a discounted price of $199 for the full thing. So the conferences are a great place to stay up to date, as well as the rapid recaps. Which I think, Naomi, you mentioned you and Taylor have a thrombophilia case coming up. You were going to phone your friend Bishoy on. So this would probably be a good one for her to watch.
Yes, I do actually. Bishoy, I welcome you to the floor. I was hoping you could help me out with this patient. This was a 28-year-old female with history of heavy menstrual bleeding. She was diagnosed with a DVT in her left perineal vein after presenting to the AD with pain in her left calf. She was started on warfarin and enoxaparin because she weighs 125 kilograms And she was told that DOACs are contraindicated in patients above 120 kilograms. And then she was instructed to follow up with her primary care provider in 1 week. During her visit with the PCP, it was decided to complete a full thrombophilia workup, which came back positive for lupus anticoagulant, protein C and S deficiency, and antithrombin 3 deficiency, and then negative for anti-beta 2 glycoprotein and anticardiolipin. So she was referred to the anticoagulation service for INR management and given the following strong recommendations from her doctor. So the first one was, because you have an unprovoked DVT and strong thrombophilia, you must remain on anticoagulation for the rest of your life. The second one was, because you are obese and have antiphospholipid syndrome, you must remain on warfarin. Oh, and also, by the way, you should never get pregnant to avoid a miscarriage because of the antiphospholipid syndrome. So now here she is. She's presenting a week later for her first INR check. The first thing she said to me with tears in her eyes was, "My life is ruined." And so at this point, I feel like something isn't really sitting right with me about this patient. It's going to take us about 45 minutes before the INR comes back from the lab. So I was hoping that maybe you had some information. I mean, what do you think about this, Bishoy?
Yeah, thank you, Naomi. It's really nice to see you, and I'm glad to see that Taylor is getting trial by fire here. So let me go ahead and jump in. How often is it that we get a case that just has so many different facets to it, and we have very little time, and we're scrambling at the last minute trying to piece things together? We'll start at the resource center right here first and foremost. And with a case like this, we want to kind of unpack it and gather as much information as possible. Um, with the resource center, obviously, there's so many different places we could go. If you had time, you could jump into the VTE section. When the guidelines come up here, you can look through all the guidelines. There's, as you can see, 11 guidelines. But as we said, we are really short on time here. So let's unpack this kind of step by step. We know that the patient's going to have to remain on anticoagulation for 3 months because it is a blood clot. So that's not going to go. But what about this warfarin question that comes up? Um, so we have resources that help fight time famine, and those are between the clinical FAQs and the rapid resources. So for a question like this for obesity, for example, there were 2 reasons why the patient was sentenced to warfarin, is because the patient was, one of them was obesity. So if we jump into the clinical FAQs, we see the categories here. And for DOAC dosing, we can click that and we'll see the obesity question answered here. And these resources and questions are answered by a group of about 30 volunteers who are all practitioners and providers within anticoagulation. And they spent a lot of time gathering all these things together so that way you have something to present to your providers and colleagues rather than just go tit for tat and everyone just sharing their opinion. What is the evidence that's out there, quick and concise? So won't go through this here. Everyone can kind of review it on their own, but pretty much it answers the obesity question, citing from the 2021 ISTH guidelines, which pretty much say that obesity should not be an issue when considering which agent to use. One thing I will say, and I believe Candace covered it as well, is if you're so overwhelmed here, what you could do is actually type in obesity into the search function, and it will pull the resources as well. And you'll see here the FAQ was brought up, but you'll also see the 2021 ISTH guidelines that cover obesity, a few other articles and papers as well. So if you need more information later, you can do that. But this search function here is it's a game changer in terms of finding resources, especially if you're pressed for time. So with the obesity question answered, what was the other thing that was keeping us from using a DOAC and sentencing this patient to warfarin? It was the issue of thrombophilia. And you all are right to feel a little uneasy about the recommendations that were given due to thrombophilia. So we can jump into the rapid resources to see if we have any quick references rather than again, looking at 16 different guidelines and trying to piece together the information, or jumping into Google and trying to parse through that, go to the Rapid Resources section. And here we have a section on thrombophilia, along with a bunch of others. And you'll see here thrombophiliA testing. Once that's clicked, it'll pull up this rapid resource, again, developed and created by the experts and within AC Forum and outside of AC Forum. We will pull in experts who specialize in this, and to develop a quick, concise recommendations. So on the second page here, you'll actually see logistical considerations of thrombophilia testing and tests affected by anticoagulation. We can pretty much safely assume that the thrombophilia testing that was done in this patient, which was 1 week after starting warfarin and Lovenox, that we see here that warfarin affects all of the ones that came back positive. So either this patient has really bad luck and they actually have antiphospholipid syndrome, protein CNS deficiency, and antithrombin 3 deficiency, or, which is the more likely situation, where warfarin has affected all of them. So now we can go back to the primary care provider and be like, hey, maybe this patient doesn't have all of these, if any, because the tests were done under inappropriate circumstances. And we can maybe then reel back the issue of providing the patient with warfarin. So now that that's all out of the way, and we can maybe use, we can feel pretty safe about using a DOAC in this patient, the next question then becomes, well, what DOAC should we use, or could we use, or maybe is there a DOAC that we should avoid? One of the things about this patient that we realize is a 28-year-old female with heavy menstrual bleeding. So there's a women's health subject here. So what do we have on that? So another rapid resource that we have here, for example, that was recently developed was anticoagulation use in menstruating people. So pull it up and see what we have in there. Are there any recommendations or guidelines to go by? And we have this little table right here, right at the bottom here, where it'll show you the incidence of clinically relevant non-major bleeding or major bleeding of the different and various anticoagulants. So we'll see here, based on this, I should avoid rivaroxaban because of it appears to at least be have a doubling of increased risk of bleeding versus warfarin, whereas the other DOACs seem to be relatively equal, or maybe even less in the case of dabigatran. So now I am armed with information really quickly to go back to the patient and providers, our colleagues, with to enhance our shared decision making. One thing I always say about shared decision making is that it is dependent on the information that we are sharing to make these decisions. So sometimes the information that is being shared is not completely accurate, so therefore our shared decision making kind of falls apart. So using these resources here, it'll help us go to our patients with the best and most up-to-date information, so that way our shared decision-making is as robust as possible. So Naomi, I know I threw a ton at you and Taylor right here with a bunch of information. How are you thinking about all this at the moment?
This is incredible. I appreciate it. I'm wondering how up to date this information is. Are these resources updated in real time?
Excellent question. As much as we try to stay at the forefront within the Centers of Excellence group, information is rapidly changing. You can see at the bottom of each rapid resource when the resource was created, when it was reviewed, and when we plan to review it again. So, trying to keep track of all of it and updating these in real time is almost near impossible. However, we don't leave you hanging. Candace covered with you all the literature library, and this is where I would go to ensure that I have the most up-to-date information on any various topic. So for example, let's use the women's health issue. We have a 28-year-old with heavy menstrual bleeding. Does she need, or is there more information? Is there more up-to-date information that's out there? So you can see in the literature library all of the topics that we categorize by. And then here we have women's health. So what I like to do, I like to go in and then say filter by, let's say the last 4 months, for example. What papers have been published in the last 4 months related to women's health? And we'll see that there are a total of 14. And as mentioned before, we do star these. We curate these papers every 2 weeks, and we will star ones that we feel are high impact. So I like just to star them because the work has already been done. You can do it by date as well, but I like to star it, see what's been up there. And we'll see here back in September, there was a toolkit developed by a group of experts for women's health with blood disorders. And you can click on that and review it and see if there's been any updated information on that front.
Amazing, Bishoy. So there's something that's still kind of bothering me a little bit. What do you think about this indefinite anticoagulation recommendation?
Yeah. So another thing too, right? Sometimes we have patients that are sentenced to long-term anticoagulation, and really maybe they shouldn't be. And this is really something that we as anticoagulation providers, whether we're pharmacists or nurses, should help assist with, because and a lot of times we are the experts at our facility when it comes to these. So again, jumping back into the rapid resources, you could go, into all the guidelines and look at, okay, what do all the guidelines recommend? But as we mentioned, you can quickly go to the rapid resources because we're short on time, and let's see what's there. And one of my favorite ones that I like to go to, and I use it almost at least twice a week, is the summary of guidelines for various venous thromboembolism. And the reason for that, it has this, I call them the VTE man, probably not the right term, but is this right here. One thing that we noticed about this patient and their diagnosis is that they had a clot in their perineal veins. And well, for me, I'm not that great with anatomy, and I'm not a radiologist. I don't. Where is that? Sure, it might be a deep vein, but where is that in relation to? How does that relate to us? So this right here really does a great job of breaking down the various veins and where they're located. So we see here all the way at the bottom here, the vein that our patient had a clot in. And it's color-coded, and you come right here. It is a deep vein thrombosis, but it is a distal deep vein thrombosis as opposed to what we normally see, the more serious ones, more proximal. And we have the guidelines here, and it'll summarize the guidance for distal, isolated distal deep vein thrombosis. And we see here that really the recommendation is to treat for 3 months. And after that, we can look at discontinuing therapy. So another thing here. So we used all these rapid resources and the resources within the centers of excellence to really pull back a lot of things with regards to this patient, who rightfully so was pretty devastated with the information that she received. But as we know, blood clots and anticoagulation is no longer this very easy dichotomous type of field where there's a lot of nuance in it, and being familiar with the resources that are out there will really help us navigate these patient cases.
Thank you. Thank you, Bishoy
Yes.
and Candace. And both of you have shared some really excellent resources with us. I would like to invite Tara to the stage. I've got another situation for you. Hi, Tara.
Hi.
So my staff here, they feel like with all the resources that we've received from Candace and Bishoy, that they are really, really well versed in anticoag at this point, and they want to take the next step. So what do we do to help sites to become centers of excellence?
That's great. We love that. We want sites to take the next step. And, we're so excited to have all of you here with us today. And we know that many of you are parts of communities and clinics that are already designated as centers of excellence. And some of you may be joining in, hoping to hear more about, becoming a centers of excellence and, what that means for you, for your site, for your patients and your providers. So you can see right here on the homepage, we have a whole drop down dedicated to centers of excellence. So if you navigate here, you can see the wonderful Arthur Allen has a video for you to be
Tara,
able to, yeah,
we do not see the homepage.
you do not see the homepage.
We see the Windows background.
That is good to know. Hold on, let me try that again. There we go.
We're live, folks. There we
Yes,
go.
look, here we go. But as I was saying, I tell no lies.
Okay.
The wonderful Arthur Allen is here with this lovely 13-minute video all about the Anticoag Forum Centers of Excellence and, why it's really important because, the whole premise of becoming a Centers of Excellence is showing your commitment to this space and providing the highest quality of care for your patients and to becoming a center that people can really trust for the best, latest information when it comes to antithrombotic stewardship. And if you are not currently a Center of Excellence, it's nice to know that you can look at other sites and see if there's anyone in your area that you might be able to reach out to and talk about what they've done to become a Centers of Excellence and meet other peers in your area. I know for myself, I'm in Massachusetts, so it's nice. You can see there are a whole bunch of clinics, and we do routinely talk shop and see what's going on in the area and help each other make our practice better. So that can be, a great place to start when you're looking to become a Centers of Excellence. And the other nice thing that we do is when you go to this Learn More button, you can see that we have information on the enrollment process, how to prepare, and the assessment details. And if you click on Start the Assessment, it will take you to a page where you can log in to actually begin the assessment. But if you're not sure if you are ready, you can go to the Centers of Excellence drop-down and download the assessment for review. So here you can get a sense of the domains that we're looking for. So you can see we're assessing disease state management, transitions of care, and service operational performance, and patient and family education.
Wait,
So I want to take your time to go through this and make sure that you have the knowledge, information, policies, protocols, and procedures to feel confident when you take the assessment. And then if you are ready to take the assessment and you pass the assessment, one of the wonderful benefits is that you get to be part of the innovation circle. And you can see we go back to our account dashboard. So my site is a Center of Excellence. So we have this innovation circle listserv that we have access to. And this can be great because what it is it's a direct network to other peers that are also part of the Centers of Excellence community. And you can ask questions in real time. And I like to peruse it. People will ask questions about difficult cases and also practical workflow questions. For instance, this past week, I looked into this section because we are adding a pharmacy technistician to our workflow, and that's new for us. So I wanted to see if anybody had any information, and I was pleasantly surprised that when I opened up the listserv, that right here they were talking about pharmacy technician roles in anticoagulation clinics. So I was able to click on this, see the link, and know now that I probably want to reach out to Jennifer Hardman and ask some more questions about the incorporation of a pharmacy technician into the workflow and how we can really optimize things for our clinicians. So it's really great. It's a nice, fast, easy way to get connected to your peers and ask questions in real time and get quality answers from other members of the community. And then if you think that maybe you need to do a little bit more work to revamp your program or take a few more steps before you take the assessment, we do also have a lot of resources to help you. For example, if you were looking at this and you thought maybe you need a little bit more help with your periprocedural care pathways, well, you can go to the Resource Center. We can go to the Periprocedural tab and then get actual examples of excellence from other ACE sites that have submitted their policies, protocols, and procedures. So I like to, look down, see if anybody has anything new and updated. And there's a great protocol here from the University of New Mexico. So if you click in here, it's a great overview of their scope and purpose. And it also takes you through the step-by-step plan with dedicated support for how to assess the patient's bleed risk, the procedural risk, what to do with anticoagulation as far as warfarin, injectables, antiplatelets, and really optimize their care plan before and after the procedure. We also have on the resource page, if you go to the home tab, I like to just filter by quality improvement, because then I can get a sense of what are comprehensive tools and resources that I might need as like a 101 one-stop shop for all things anticoagulation to help educate my staff, update our knowledge base, update policies, protocols, and procedures. And then we also have this service operational performance tab. And this can be great for people that are hoping to become an A site, as well as sites that are already existing as an anticoagulation center of excellence that are looking to take their sites to the next level. So you can see we have a lot of great resources for billing, if that's eligible in your state. We also have a lot of good performance and quality resources. So you can see if you're looking for different ways to update your policies and procedures in your clinic. We have comprehensive resources like this one from Atrius Health that walks through how you screen a patient and who's eligible for referral. How do you do the baseline education? What about if they're non-adherent, and what are those processes that you go through? So this can be a really great way to make sure that you're covering all the bases within your clinic. And it also lets you know other people in this space that you could reach out to if you have questions or want some additional answers or support. And then occasionally you might scroll down and see things that you would like to see, like this, sample of performance metrics. And every once in a while we'll find a broken link. And I think that's common on any website. But when you do find these, it's important to please let us know. You can always send a quick email to info@acforum.org. And we will do our best to either find an updated file of this for you to have, or to connect you with a resource that might be comparable in this space. And so this can be a great stop for, if you're looking to add collaborative practice agreements into your space, or like I said, performance metrics or different competency assessments. I think it's also great too when you're thinking about opportunities for stewardship in your space, and thinking about our digital dashboards on your radar, or potentially adding and expanding to include DOACs into your practice. So I think this can all be a great way to start thinking about getting started as becoming an A site, or to advance your practice to the next level. And then when you're in that place and space, we also have this great resources under the Anticoag Stewardship tab. So when you click here, you can learn about all things related to anticoagulation stewardship, and we have a lot of great resources for you. So the core elements to teach you about the fundamental principles of stewardship, and then the accompanying playbook to put those principles into action and start having those conversations, doing the quality improvement projects, collecting your metrics, and then being able to speak to leadership to help further your initiatives. And then we also put these tools into readily accessible avenues for you to access. So like the advocacy resources, webinar playlist. I find when you go up to the top to the stewardship dropdown, everything is laid out really nicely in these grid patterns, so you can see quickly. If you want help talking to your leadership team about anticoagulation stewardship and what this means at the national level, I find this resource particularly helpful as well, because it speaks the language that they speak. So we can talk about quality, but also talk about outcomes and savings in cost and prevention of adverse events for our patients. So they tend to look, when they say that, if with a little bit of help with things like helping with clotting factors or reversal pathways or HIT management, we can not only improve patient care, but we can decrease costs associated with adverse events and delays. So that can be a win for both sides when it comes to anticoagulation stewardship efforts. We also have profiles in progress. So if you're curious of what your peers are doing, this can be great as well. You can always reach out to these institutions, see where their projects are at, or start to get a model of what things could look like in your setting. So are you ready to take on the next step with inpatient programs or outpatient initiatives when it comes to deprescribing? So you have all of this information to fall back on right at your fingertips. And then, of course, some access on how to develop a business plan and the urgency of why these actions are needed now. And then for those of us like myself that are continuously advocating for getting a more of a population health approach to our care, we have this great resource on using population health-based digital tools to advance anticoagulation stewardship efforts. And so this can be a great thing too to print out and talk to your leadership about. And then, of course, you know, the Innovation Circle, and then podcast webinars, peer-reviewed publications can also be another great way to learn more about stewardship opportunities. So we have here, you know, great podcasts from Allison and colleagues, international, local level, how to focus on DOAC management models, how to think about, you know, using the playbook and putting it into action. So I really recommend that you guys take the time to check out and see what's here, because this is what we need to start thinking about when we're looking to advance stewardship efforts, not only at our local levels, but on a national level as well, and making sure that we are meeting and exceeding the national patient safety goals and seeing what other gaps we can fill with care.
Thank you, Tara. I mean, this is amazing. I really honestly did not know we had all these resources on the website. I'm going to invite everybody back so that we can adjust some questions. Okay, so I understand that we have some questions from the Q&A that we want to try to answer live. Is that right? Sure, I think you
Yeah.
had one, related to
Sorry.
online drug anticoagulation interaction resources.
Yeah, there was one question about DDIs and if there's any online resources for that. So I did answer that in the chat, but just to clarify with that, the DDI resources that are out there, if you're just looking for, I put in a drug-drug interaction, I get an answer, yes or no, I'd be careful with those, because those are notoriously, they vary across different platforms that you're using. So the reason I pointed you towards the rapid resource is it helps you think about a drug-drug interaction. And the information for drug-drug interactions is changing. About every other month, a paper comes out. So the suggestion here is take the rapid resource, develop a way to think about the drug-drug interactions, and then from there, use new information that's coming out. But I would still be careful about using any platform to say, oh, this is a contraindication I shouldn't use, of course, except for the inducers. That's pretty standard. And then I would also encourage you to look at the boot camp. There have been a few discussions about drug-drug interactions there, but just wanted to clarify that a little bit more.
Thank you, Bishoy. So there was a question about how somebody can check to see if their hospital is a center of excellence.
Yeah, I can take that one, Naomi.
Okay, thank you, Candace.
Yeah, let me pull the webpage back up because I just want to show you guys where to find this information. So on our webpage, when Tara was showing earlier about our centers of excellence, so under centers of excellence, about centers of excellence, we have a link here that says that shows all the current centers of excellence sites. So you can select that link and that has the list here. So that's how you can check if you're a current center of excellence. You can also email AC Forum as well, and I'll drop that email in the chat just in case maybe you think you're a center of excellence, you're not on the list, you have a question. Then there's an email that you can email to inquire as well.
Thank you, Candace. So another question, quite specific. Are there any specific copyright rules or recommendations for sharing information from the rapid resources with healthcare professionals at our institutions? For example, if we were developing a guideline of our own, can we use a table from a resource and then reference AC Forum?
Looks like Amanda is going to type the response for that in the QA. So everyone look at the QA on that.
Thank you. It looks like, to share widely, then you would need to get permission. But it is open to the public. These resources are open to the public. So thank you. We'll hold tight and await that response. Okay.
There, let's see, I was going to say there is one question in the chat about maybe doing a walkthrough through the literature library, which I think we would have some time for. Bishoy, I feel like you're the expert on that. If you want to give us the rundown.
Put me on the spot there. Yeah.
Pressure.
Let me pull that up. I think there was, as I'm pulling this up, there was a question about, was there a final decision on the patient with regards to her obesity, coagulation disorder, and heavy menses? So we pretty much dispelled the coagulation disorder, that all those were probably falsely positive. And then her obesity, not an issue, so they could use a DOAC. So then when it comes down to which DOAC to use, I personally would use dabigatran just because it seems like it has the best bleeding rates. But if you use the Pixaban or Edoxaban, which I think 7 people in the country, I say that jokingly, but no one really uses Edoxaban very much because it was Johnny come lately. But any one of those, but I would avoid Rivaroxaban for that patient. All right, let me share my screen here, just so. Well, the first time that we did this, it was pretty seamless. So, okay. So for the literature library, the way I would do this, and for the DDI specific question, the way we put the DDI questions in drug information. So, or sorry, drug information. So I would click that and then see what you have there. So in the last 15 days, you'll see the papers that are here. It would be a good practice to you check this periodically, because then if you go, so here, for example, November 9th, just recently, there was drug interactions, the anticoagulant therapy, a focus on oncology patients. So then I would we'd look into that. And then you can go in the last 90 days or however long, but that's specific for drug information. If, however, you didn't do that and you went, say, all topics and you typed in interaction, it will pull up papers that at least have interactions. So you'll see there are 23 in the last 90 days. And as I said, you can filter by star, by date added. So again, here's that oncology paper again. You have contraception use among women, not necessarily drug-drug interactions specifically with regards to pharmacokinetics, but just more so how to deal with therapy there. But that's kind of how I would use it. And then, if sometimes we will highlight some of these papers in the rapid recap, but really the literature library would be the go-to to stay abreast on whatever topic it is that you're focusing on.
So we have a response regarding the copyright rules here. So the rapid resources, like I said, they're publicly available, but you have to cite the Anticoagulation Forum specifically, and if possible, link the Anticoagulation Forum website. For rapid resources specifically, please also cite the date of being published and the updated date if there is one available. You can also reach out to info@acforum.org with any additional questions regarding sharing of the resources. Okay. So Tara, I have a question for you. For those of us who are considering expanding our services or getting more into stewardship, but we're running through some pushback from our leadership, do you have any recommendations for how to handle something like that?
Yeah, I mean, I think being equipped by reading the core elements playbook and the stewardship playbook can really help with understanding the language and the things that they want. And I think one of the big messages that came out of those documents are, learning to meet the needs of your institution. If you can meet in the middle, figure out where the common interests are and align your goals, and then determine, your steps forward from there. It can be really beneficial. And then, going through into the stewardship tab, using the literature library to find the latest and updated, papers that are coming out related to stewardship can help support that your idea isn't like, new or novel or unique. You're doing something that has been shown to have, you know, an impact and effect on patient care, whether it's expanding to DOAC management, aspirin deprescribing, you know, making a better strides or improvement on, you know, taking care of warfarin patients and keeping those clinics open in spaces where, you know, they might be challenges to have, you know, space for those patients. I think that using these resources can help you come with facts to back what you know is the right thing to do for your patient care.
Thank you. Okay, and so with that, I will close us out. We're close to time here, so thank you guys so much for being present. I wanted to say a special thank you to our Anticoagulation Center of Excellence Committee, including our current and past chairs, Candace, Tara, Bishoy. Thank you so much for being here with us today. Really appreciated the conversation. I learned something new myself. And thank you to all of you for joining us. We'll see you next time. Bye-bye.